Welcome back, everyone, to another episode of the Health Made Simple show. I'm here with our host, Dr. Bart Precourt, who has been a healthcare practitioner for over 20 years, practicing a range of modalities, including chiropractic, acupuncture, kinesiology, functional nutrition and supplementation, and lab testing, all out of his clinic, Balance Health Studio in Seagrove Beach, Florida, as well as virtually all around the world. So he's also the founder of the Health Edge program, which is a cutting-edge health program for entrepreneurs and executives wanting to take their health to the next level. So he's worked with celebrities and athletes all around the world. And tonight, we've got a few clinical insights you want to kick us off with.
Yeah, I have several. And, we have a couple weeks here that we did talk. So I've got a couple cool things. So I want to start off the first one. And this was from last week. I'm just going to call her Miss M. And Miss M is a 74-year-old female. And she comes and sees me for the most part, like clockwork every 2 months.
Okay. Nice.
Okay. So it's just on her schedule. And even if there's nothing wrong, most of the time there's nothing wrong. Actually, almost literally all the time, there's nothing wrong. 74 years old.
Because she comes to see you every 2 months.
And this is why I want to share this. So that's one of the many things that she does to stack her health. And that's a conversation that we've had on here on Health Made Simple shows, stacking. So check this out. She walks 7 days a week, 4 to 5 miles per day.
Yeah, amazing.
That's legit. And if you go out and walk 4 or 5 miles, that's legit. Like that's a good walk. You don't walk down to the mailbox and back. That's a 5-mile walk is an excellent walk. And to do it on a daily basis is just awesome. And on top of that, Karen, she exercises with weights and or what we call like ballistic or dynamic movements 4 to 5 times a week.
Wow. So she's keeping her muscle mass. She's keeping a bit of cardio going.
Yes, precisely. She's strong. 74 years old. So inevitably, of course, I'm going to ask her the question, why? Why, Miss M, do you continue to do this? She gives me 2 really fast answers. One, she's like, it feels good. I just feel better. I'm nicer. I like my husband more. It was
good for everyone.
Number 2 was, if I don't, I will die sooner.
Yeah.
And what's fascinating about that answer is that there's one of 2 reasons that we're going to take action on anything in our life, anything. We are either going to do it for pleasure, which is most of the time it's not for pleasure. So about 20% of the time, we're going to do something solely on this is going to be pleasurable for me. So her first answer was because it feels good. So she's doing it for pleasure. So that by itself puts her in a unique category for doing something that's hard to do. That's exercise. And number 2, she didn't want to die, and that's pain.
Yeah.
So I don't even know if she realized that she uses, and that's really what I want everyone to take away tonight. She uses both as motivating factors. If you can use pleasure and pain to motivate you, there's a high likelihood that you're gonna take action and sustain it.
Yeah, I love that.
For example, the difference, Karen, may be if someone just doesn't want to lose weight.
Yeah.
Or they're just trying to lose weight. They just don't want to be fat. Sometimes there's not enough pain in it.
Yeah, it's true.
Or there may be no pleasure in just trying to not be fat. But if we can put both of those in there, some pleasure, I'll feel good, I'll look better, I'll move better. And then also the pain, well, I might end up with arthritis. I might not be able to move as well one day. I might not be able to pick up my grandkids if I don't get healthier. So that it was fascinating for me to see as a practitioner, again, 74 years old, and she's a buzzer. And just in a little side note, clinically, she has a pretty significant scoliosis. Okay. And for a lot of people out there, and the reason I mentioned that is a lot of people think that's a limiting factor. A lot of people think that their things are limiting.
Yeah.
And they're not. So I've always told my scoliosis patients, listen, as long as you keep your body moving, your spine and my spine are no different. That's it.
Yeah.
And that's important to understand. It's not a boogly woogly disease. It's just how you were created with some curvatures, as long as you keep yourself moving. So that was my first clinical insight. And it's always motivating to me when, especially I have someone that I would consider a little bit older, right? I know a lot of people think that I'm older because
some people heading into their 70s start to slow down, maybe they're not walking every day or moving every day, and so to have her really prioritize that is awesome.
Yes. Now, a little side note to that story, her husband now goes to the gym 5 days a week. Not something he did his entire life. Now, it is as a result of having multiple heart surgeries, etc. But he is now doing it 5 days a week, happy as it can be. And he goes to a different gym that's associated with the hospital. So it's fantastic. So his pain moved him into action. So he's lucky enough to have that opportunity to do it. And I love him. I know the couple, and I love them both. And it's really nice to see that they have used their pleasure and pain as motivating factors. So I think I share this one, especially because if anyone thinks for some reason, maybe their age is the reason that they can't move forward, no, put that poor excuse behind you. There's always a place that you could start today that would improve your current status to help you become better tomorrow. And listen, I get it. You may not be 20 again, but that's not really the goal, is to improve our current status. So that's number one.
You can always do things. I always love, like, I talk about her because my grandma is going to be 99 in July. And, you know, she had a new hip and a new knee in her 90s. And when the physio, she had a knee reconstruction at 95 and a new hip at 94. And when the physio gives her exercises, like she loves to do them. Like, I really almost wish she could go every 2 months so that like someone could give her some new exercises, because she's the most compliant. And you should see she does like those squat holds against the wall, you know, like she does like awesome exercises, and she just always does them, and she starts them because they're new exercises. She gives them, you know, this will be a new one, you're starting at 98. You know, she just wants to do them.
Literally amazing. So again, shout out to everyone who might be thinking, and I do understand if you think that your age, and it could be 40. Some people think at 40 that they're over the hill. This is the starting to decline, 50, 60, 70, 80, whatever it may be. But just know that our actions today can lead to a better tomorrow. So
my grandma's not running. She's not trying to like start a run club. Like,
and it's the wisdom that comes with that, and the expectations, and it's to create a better tomorrow relative to where we are today. It's not necessarily trying to reverse a clock 20, 50 years. So the second one, similar, and not all my patients are in their 70s, but nonetheless, it's not next one. I'm gonna call her Miss Carol, and she's 71. And this is a situation where there was post-viral syndrome, also known as long hauler syndrome. All right. So this came up twice. I'm just going to talk about Carol's case. In this situation, Carol had COVID. It hit her, I would say, mildly. Okay. But her symptoms, her long symptoms, were beyond mild. They were heavier. So those symptoms, almost all long hauler syndrome, come with fatigue. So she has definite fatigue. Depression has come with it, which is a bummer. And her body's immune system's breaking down. Now, all of a sudden, she's never hasn't had, which I think she described to me in 30 or 40 years, she's having severe ER type UTIs. And she's been in the emergency room a couple of times in multiple rounds of antibiotics, and the words that are coming out of her mouth, and I'm getting this second fiddled from her husband because she doesn't want to leave the house at this point. That like not good words, like, you know, where she's at right now, she doesn't like, it's dark. And the reason I'm bringing this up is for a couple of reasons. Listen, if you know anyone that has long hauler syndrome, there's not a quick fix. There's not an antibiotic for this. I say there's not a quick fix, but there's definitely strategy. There are 4 and only 4 reasons that people have long hauler syndrome. I'm going to rip through these real fast here. One is that the immune system wasn't ready. So what I'm talking about, Karen, is that the people that got COVID and got either hit really hard and or it extended out. And so in this situation, and this is not new, it happened during COVID, but post-viral syndrome is very common. This is what I spoke about down in Orlando. So number one, the immune system wasn't ready. And I agree 100% that this is a problem worldwide. I think I've calculated all the labs this year that I've run, and I have less than 5 people who've had normal optimal levels of vitamin D. It's all the labs my clinic is
and a lot of them lived in Florida, like we've said
Karen,
before.
And here's the thing, I'm 2 of them. So
wow.
Yeah. So I don't know that, Yeah, I
That's
think
not
I've either
good.
had 2 or 3 people's labs this year come in with optimal levels of vitamin D. And yes, I live in Florida. I know I see people all over the country, but nonetheless. So that's significant. So if we're going to bypass that, understand, and then you get something that a virus that comes in and creates a cytokine storm, it crushes your immune system. And you think just time is going to fix it, and it doesn't always, especially if we have other things going. So number one, you had a low immune system. Number two, you have some type of autoimmune condition. Millions upon millions
So
of
many
people.
do.
Yeah, and especially women probably have autoimmune conditions like 3 or 4 to 1 to men. Hashimoto's is right on top of that pile, but that's all there's arthritis is out there, gut issues, and that's a very significant one. And so that's where a lot of the issues with like Crohn's and IBS, all those fit into that category. And then when that individual has a cytokine storm, a virus that comes in and does a little bit of butt whipping, it wipes out the system. And I'm going to get to where all this is going. The third one is stealth pathogens. This might be the biggest one of all. It's completely overlooked. Predominantly, like the big picture here, we're talking about Epstein-Barr virus. Yeah,
like
even on,
there's a huge percentage of us that have it, right?
yeah.
Like,
so I just told you my statistic with vitamin D, and every now and then. So when I run the post labs, those vitamin Ds will come up, but I'm talking about the initial one. So vitamin D is easy to change, folks, and there's an at-home test you can run. It's like $70 or something. Anyways, Epstein-Barr, the past 2 years, I've only had 2 people not have antibodies, meaning they've been exposed to and have Epstein-Barr when I test. And it was just a random situation where it's a mother and a daughter. And I still don't have a great explanation for that, but that's the only cases I've seen, including myself here. I have robust amounts of Epstein-Barr antibodies. What that means is I have been exposed over and over and over again. So these stealth pathogens, Karen, and I know we've covered this a lot in the past, but what happens with the stealth pathogen, it lies there until you're vulnerable.
Yeah.
And then when you get vulnerable, now let's just stack these first 3 up. Low vitamin D, everybody. Until proven otherwise, you had low vitamin D. Epstein-Barr, everybody. Until proven otherwise. Autoimmune, tens of millions in this country. So 2 out of the top 3 right now means that if you had COVID and you had those 2, there's a good chance that you were going to take a whooping.
Yeah.
And then the fourth reason for this is blood sugar dysregulation.
Yeah. Which again, I mean, what percentage? It's huge.
Huge. Now some of this could have been on a micro level, meaning literally last night you went out, or last week or 2, you were drinking more, you've been eating more, which was our entire country during the lockdowns, probably across the world. How do we know
we
that?
like closed all our like shops and whatever, but we left liquor stores open. Liquor stores were
so did we.
They went through the roof. The sales were just
yes. So most likely everybody had 3 of the 4 main factors. I didn't even talk about comorbidities. I didn't even talk about cardiovascular disease and stuff like that. Those 4 that I was just talking right there, that's all you needed to have 1, 2, or 3, or maybe even 4 of those.
Yeah.
And you would set up. Now, the reason I mentioned those is because that's how we got to correct them. We got to reverse engineer this. But the first thing is, what's most common, again, all people that have long hauler syndrome. And listen, if you know somebody, because I had 2 cases today of really them talking about someone they're still not well, and now they're going to Mayo Clinic. They're not going to fix it. I'm telling you that up front. They're not going to fix it, because the fixing goes like this. 1, we have to test for and understand the state of the adrenal glands, which isn't even the 4 I talked about, because that's what will get beat up. And if you're in adrenal dysregulation or dysfunction, or maybe even fatigue, no matter what you do immune wise, you won't be at your best, because your adrenal gland, that's the fight or flight hormones. Those are the ones trying to defend you. So we need to make sure that whatever we're doing, it's and that. Second, when we have a viral attack, when we have an autoimmune condition, what is the number 1 cause of all autoimmune conditions? Leaky gut. Yes. What is the number 1 cause of, what happens when you have a virus in the body? Gut dysregulation. What happens when we have blood sugar dysregulation or dysfunction in the body? We have an imbalanced microbiome, dysregulation in the gut, dysbiosis. So adrenals and gut are the first things that have to be taken care of. So anybody out there with long haulers. And so what I would suggest, either get with someone who knows about these. I'm telling you right now, they're not, there's no one out there. Well, there's the functional medicine world is. So if you find someone out there like the men and women out there doing this work can certainly help with that. And it's not that hard. That's the stuff we've been doing all the time. You just kind of got to put a couple of them together, but definitely worthy, or find someone that can bring you in a different direction. In this scenario with Miss Carol, with the UTI, we're in trouble right now. Let me explain why. 3 straight rounds of antibiotics on top of all of this, of the long hauler syndrome. And her husband came to me. The only reason he actually mentioned to me, he said, this is how he phrased it. He says, does depression really come with age?
Oh, wow.
Yes. No, correct. So that's what I mean by everyone's missing it.
Yeah. And especially I've had people kind of say, oh, well, but I'm negative now, so it's not COVID, or I'm negative. I've tested negative now, so it's not to do with any of that.
Yeah. And that's the unfortunate part. So when, any of us that had COVID, your body went through a battle. If you had incredible good health regimens, you get through the battle, you still got beat up, good chance you took at least a couple bruises, and then you had to recover. And if you have good everyday practice, you're eating whole food, you're resting really good, you understand how to detox, you're helping your liver, you got some milk thistle going on in your body. It's fundamentals. How many people were doing that? I don't know. Probably a fair amount of our listeners were doing something in that line, at least the rest part, and getting the proper supplementation, the good B vitamins back. But most of the world, not a chance. Not a chance.
Oh, no. Weren't doing anything.
All right. And I know we're going along on the clinical insights here, but I still got another one. Yeah.
So I think it's good to keep talking about that though, because as I said, I had somebody this week talk again, she's finished COVID, tested negative, and now she's, 2 weeks after, I think, her negative test, she's now in ER with like heart pain, like chest pains and all these symptoms. And again, nobody's kind of, but she's negative. So it's not, nobody's really helping her.
Yes. And there's really no system. We've never seen, Karen, in our healthcare system, your healthcare system, we've never seen tens of thousands of people simultaneously, really in a small block of time, have post-viral syndrome.
Yeah.
So we never really were able to look at it globally. And the only reason I have any insight of this, partially, is because I don't like when I can't get results. That's honestly, that's what drove it. So when people had the myocarditis or the losing the hair, I was losing my mind because my normal protocols, my normal strategies weren't working.
Yeah.
I had to back up and look at the bigger picture. And that's really what functional medicine is all about, and look for these root causes and really step back and say, okay, I got that. What's the root of that? What's the root of that? What's the root of that? And go back to, and that's really where there's those 4 things. And that's pretty universal. So it's not just Dr. Bart's. Some of that was self-understanding, and then going out and confirming with a lot of my colleagues. It's crystal clear. It's those 4 things. So I think this conversation needs to be had more often. The bummer is you still can't talk about it publicly.
At
least not social media and stuff like that. So I don't even know what happened to this. So you'll get that little flag that says COVID-19, more information, click here.
Fact check.
So just know, and don't be afraid. I say it's hard work, or it's a lot of work, but it's nothing that we don't do every single day as practitioners. It's just very strategic, and I think that's my point tonight. Don't give up. And Miss Carol, it was in a little bit of a situation of don't give up. So what we've figured out is we've scheduled an appointment where my friend is, my client is going to bring her in so I can talk to her.
Yeah.
And at least have a conversation with her, and probably put a lot of her fears aside the best that I can, and move her in a direction of making tomorrow better than today. So
yeah, for sure. Because also, if she keeps getting sick, chronic UTIs aren't, horrible to have and have to deal with, and constantly not being able to leave the house, that's going to affect your mindset regardless of what else is impacting your depression. Right?
In the UTI world, we've had enough experience with it. Literally, we've got it pretty dialed in and understand the mechanism that the body goes through to do it. There are a lot of things out there that kind of help, and then there's things that really get to the root causes. At the root cause of it, Karen, it's a pH imbalance.
Yeah.
The alkalinity in the acidity and alkalinity gets out of balance. Technically the women become, if it's just a woman here, become too alkaline.
Yeah.
And bacteria can grow in an alkaline situation, not acidic. So we learn, okay, we have to acidify the body. We're going to go back and balance back out. And that's where we take out all the foods that are creating more alkaline, which are carbs and sugar. So that is the route if you really want to clear it up. And then you go after the bacteria with different herbs. And, there's phenomenal things out there. So we use a lot. Sometimes we use garlic. There's a lot of really, really good things that are natural, that are very effective, and they don't cause any more damage.
Yeah.
When I hear the second and third rounds, I'm always a bit nervous. I've talked about it here on the show where part of the reason that my brother passed to me early in his life, earlier than he should have, quite frankly, is because of an antibiotic resistance and too much antibiotic use. And so it is real. And the older we are using antibiotics, it's probably harder. I don't know that for certain, but it's probably harder on the body. All right. Yeah. So that was another one. I do have another one, and then I want to get into all these.
Yeah. What's our third one?
So the third one is actually two cases doing the exact same thing. This is totally different people. One again was in her 70s. The other one's in her 30s.
Yeah, but I love hearing about the people who are older doing these good health things or like learning from that. I think they're more examples, for someone in their 30s listening to it. We end up having this, well, it's good for everyone because we end up having this different idea of what aging is. I love using my grandmother as an example because I think, okay, at 98, I'm going to still be walking around the block and doing gentle gym and my exercises against the wall, like that ends up being your example of what 98 looks like.
Yeah. So this one is really a lesson of foundations. And so both of the symptoms of these cases are sinuses and sinus infections leading into ear issues, like almost like a severe head cold type thing that's chronic and won't go away. Okay. And both situations, the patient came to me saying, I think I'm having a response to allergy. Are the allergies bad? In that kind of conversation, it's to some degree, it's almost like a little bit of an excuse that we blame it on the outside in because it's always on the inside out. Right. So it's always, if you're sitting there and saying that it's in the environment, but I'm sitting here fine, not sneezing, is it really the environment? Right. Yeah. Anyways, so both situations, and the younger girl who's in her 30s, I don't even know if she's 35 yet. She went in and, they gave her multiple rounds of antibiotics. The first one didn't work at all. The second one worked until it didn't. And now we're in the phase of possibly a third. And then they also suggested that she had a surgery. And that's what made her bring it up to me. Because she's like, I don't want to have a surgery. I think, I just thought I had a head cold. I was going to take some antibiotics, make it go away. So anyways, I got caught up in chasing it, Karen. Bad on me. I got caught up chasing the symptoms a little bit. And of course, I got strategies for allergies and downregulating, and helping the white blood cells and stuff. But foundationally, when we think about allergies or histamine, so we got to think of function here. So what happens when we have congestion in sinuses? You have a massive amount of histamine that's stuck in the sinus glands. Histamine is predominantly, it can come from a lot of our tissues, but predominantly if it comes in big floods like that, it's often coming from the liver. The liver releases histamine when there's toxins or something coming in the body that the body can't handle. It can't keep it in flow, meaning break it down, attach an enzyme, pull it apart, and then send it through, the intestines or whatever it needs to do to get out of the body. So the question really is, why is there so much histamine? Why isn't the body naturally getting rid of this? Why isn't the immune system handling it? So I'm going to break it down. Of course, the fundamentals, the foundations here are simple things like, are you sleeping okay? You pooping okay? You drinking enough water? Unlikely. So for everyone out here, I'm going to give you a little dehydration test. If you fail this, you are massively, massively, massively dehydrated. All you do is, if you guys are watching, if you're listening to this, you're just going to take one of your hands. With the other hand, you're going to pinch your skin and you're going to pull it up as far as you can. And then you drop your skin. That skin should snap back as if it wasn't even up. By the time you look at it, it's already down. Okay. So yours is really good, Karen.
Yeah. I think it went down.
If that skin stays up and it slowly goes down, you are massively dehydrated.
Okay, interesting. No matter what age you are, no
matter what age, you still listen, because when we get older, we need to keep things flushing and flowing. Our skin, and I'm going to get to the second part of this for good skin health and active like vitality in our skin and in our tissues. But in these scenarios, so then I asked them, both of them totally different reasons. It's interesting, both of their answers. One, the situation was, so my goodness, you're completely dehydrated. No wonder you have sinus headaches every day. No wonders why you can't get the flu. Remember, the only way our lymph system goes to work, which is basically a system where the body brings things in. It's kind of like a safeguard. It brings things into the lymph node itself, checks it out. It's almost like a toll booth. And you got to like pass the toll. And if you don't pay it, then you're in trouble. Well, you get into the lymph system, you get into the toll booth, which is your lymphatic nodes, and you're a bad guy, your body unleashes hell on it. And that the hell is the white blood cells. And then if it swells up, it means it just made more room for more white blood cells to go kill it, which is a beautiful part of our body. It's a beautiful part of the innate immune system. Well, if you don't have water in your body, you don't keep it moving.
Yeah.
So it clogs up. So everything backs up to the liver. So the liver produces more histamine. That's one of the biggest reasons we get congestion in our sinuses. Oh. So case number one, so my goodness, you're completely dehydrated. Bad on me, because we didn't discuss this or check this box to begin with. I made a simple assumption. They're eating supplements and all these things, but they didn't hydrate. And they asked, so you're drinking water? No. How come?
People say no.
She said no.
Yeah.
I said, well, you're healthy. Why come you're not drinking any water? Well, I end up peeing my pants. She told me she's older. She's in her 70s. Yeah. So she literally, I said, all right, I get it. And you have to drink water.
Yeah.
We'll deal with the bladder. We got other protocols for that, quite frankly. We got exercise, we got protocols, foods to eat, etc. Literally, we do. So, but without the water, doomed. Yeah. Have to stay hydrated, or the body can't stay healthy. And if you care the least bit about your skin, the number one nutrient for the skin is hydration.
Yeah.
All right, case number two. Very, very similar. You drinking water? No. Why not? Well, I'm on Zoom all day long. I don't have time to get up and use the bathroom.
Oh.
Yeah.
Okay.
In both of those, 35-year-old girl failed the pinch test. Unacceptable. Completely unacceptable. And as a result of it, multiple rounds of, and I'm absolutely convinced if she was super hydrated. So the younger one, I have her going home drinking a gallon a day until she sees me again. She's gonna be hydrated. She's gonna, well, either that or she'll be like, flush all the minerals.
She's not gonna get through a Zoom call. She's gonna be.
And then the other one who's in her 70s, I have her doing a half gallon a day.
Yeah.
And she said, well, I'm gonna pee my pants. I don't care. Your health is more important than your pants to me. So.
Well, it's true. Yeah.
Isn't it?
I mean, and as you said, deal with the next problem then. Okay. So now we have to deal with this.
Yeah. So we'll see. I don't have the outcome on either one of those, but it is absolutely important for everyone listening to make sure you can pass the dehydration test. And that's not the only test, right? But that is the one. If you fail that, it's not good. The second component to that is the amount of fatty acids that you have in your body. Okay. I talk all the time about how important fish oils are for you. You should absolutely positively do an omega-3 test. It's $70, simple test at home. Prick your finger, put some blood on a little thing and send it in. Yeah. We need to know our omega-3 levels, not only for our brain function, but the fatty acids. So it goes like this. I wish I had a picture I could show, and I do when I'm teaching, but it goes like this. You have your skin, or what we call your dermatome, and then you have a layer of fatty acids. Then it's your fascia. Then you have fatty acids again, and then it's your muscle. Okay. If you don't have fatty acids, your skin will wrinkle. Your skin will then get kind of less pliable. It will cut easier. All of the things that we don't want in our bodies, the skin to break down, it won't have good rebound. You won't be able to hold collagen if you don't have fatty acids. So all of these things work in synergy, and it starts with the foundations of drinking water. So let's make sure we are doing the foundation work right. So do the foundations and you'll be surprised. And that is very similar to when I went to do the gun training last week. So I was amongst a bunch of pros, and it's one of the best trainers probably in the world. I don't know much about gun trainers, but he trains all the bigwigs, right? Okay. And we did super fundamental foundations. Yeah, super basics. And anyone who does martial arts, anyone who's a sports player, if you're a basketball player, what do you train? The free throw over and over and over and over again. If you're a baseball player, you take batting practice over and over. You take ground balls over. Foundations. You do them until you can't do them anymore, and then you keep doing them. And all the greats will always tell you that. So make sure we get our foundations down.
And I think with health, I mean, those make the biggest impact almost, don't they? The simplest things, you know, like what you're talking about: water, food,
sleep, poop,
moving a bit, thinking. Yeah.
Yeah, get a movie, eat and think right? Because if you don't have those foundations, if you're not moving at all, if you're not eating proper foods, you're not thinking good, you got nothing after that. You got a lot of stuff that you'll spend a lot of money on with most likely limited, if any, results whatsoever.
Yeah, if you don't have the foundations dialed. Yeah, awesome. Cool. Well, there's some awesome clinical insights. I think they're always good reminders. We got some time left. We want to talk a little bit about lab testing today.
Yes, let's talk about labs. So
why do we want to talk about labs?
Well, one, they can give us great data, Karen. They really can. They really can. They can help us develop strategy. And now we're in this world of there's a lot of labs out there, and there's more and more people talking about them. Yet there's foundations. That's the truth. And there's a million really good ones out there. I do run a lot of labs, and I think there's a couple reasons specifically why people don't run labs. And then I'll talk about the lab. So I think there's three primary reasons that people don't run them. And I would say this: if you're 35 plus, I'm not saying not to do them when you're younger, because it's almost like looking at, it's looking at your bank account and saying, wow, I'd like to have more money in there. Then you create a strategy, right? Isn't that kind of what you do? Or I had a lot of money in there, now I don't. That might be, I'm
what
60.
Happened?
Yeah, what happened? So you create strategies, and we're not afraid of it. We're just gonna get on the scale every now and then. So that's the way I kind of see it. And I think one of the big reasons that, especially nowadays, people are unaware of what the labs could tell them.
Yeah.
So there's three primary, say, killers in our country, probably in the world, and it's heart disease, diabetes, and cancer.
Yeah.
Okay? Those three. Our labs can tell two of those like that. At least give us the insight of, am I even in this category? Yeah. And there's more, you could even go deeper in there, but there's so much on the front end that could prevent us from going deep into those categories. So I'll talk about those in just a moment. The other part of the labs is this. In this, I want to make sure that when we're talking about this, traditionally there's been kind of like, I go to my doctor and get my labs run once a year. And I'm not a fan of that. And I'm not a fan of it, not of the action of you going to get your labs done, but not a fan of the typical, the labs that are run.
Because of what information you get, or?
Really, it's the information you don't get.
Yeah. You don't get a full picture.
You really don't. So to really make a good plan, it's very, very difficult because you don't have all the data. And now, because we know how easy it is to get the extra data. And then there's also so many men and women, especially the ones doing functional medicine, that know what to do with that data. They know how to, kind of calculate it, if you will, and then put a plan into play. And usually a very, measurable, very attainable type and action driven plan. So I think that's number one. And then the other part is who, people don't know, okay, sure, Dr. Bart, if I shouldn't run the labs with my normal doctor, who they agree, they just run my cholesterol every year, and they either tell me it's high or low and then send me home, then who runs it? And that's where you got to do your homework. I typically would say, and it's not just people that are saying, they're functional medicine doctors or whatever, but find people that are doing this kind of work. And if you ask around, you will find them. There are a lot of good people out there, Karen, right now doing this work. Heck, as much as I'd like to raise my hand and say I'm one of, there's a lot of us out there doing great work. And the truth is, we need more and more people doing it.
Yeah.
Because
and a lot of people do run them virtually like you these days, where you can order them because you can order labs, ship them anywhere across the country, right?
Yeah, literally. So just before we get on here, I was emailing out a lab requisite, which means that I would just send a lab requisite to this gentleman. He's in Chicago. He will go to his lab locally.
Yeah.
Get his blood draw. They'll email me results, and we'll sit down just like this and do a Zoom. And boom, we'll have a strategy within
amazing
10 days. Yeah, it's really, really nice. It's fantastic. So I think that's part of it too. there's another reason I think people don't get labs. And I think that sometimes they just don't want to know.
Like the bank account, when you said that, I thought about that. Like a lot of people don't look at their finances because they don't want to know.
Yeah. It's almost that ignorance is bliss. And I have kind of two thoughts on this. One, I do think that you should be prepared emotionally, the thinking part. Remember, eat, move, think. The thinking part, being prepared for possible worst case scenario.
Yeah, okay.
And have a team or someone in front of you that you then would be able to lean right back on and sit in the case of you got something that you didn't understand, that they would be able to help navigate what's next. And I think that's a big part of it. When people really are not well, they're not taking care of themselves, they feel awful. And it's this weird thing that happens in healthcare. And a lot of the other practitioners listening to this would agree. When people are at their really worst, they often come to their doctors and say, Doc, I got to get some lab tests, something wrong with me. Almost as if the lab's going to fix them. It's the weirdest thing.
Yeah.
But they need to know. And in those moments, I know for myself, I hesitate and I try to evaluate the situation and find out, in this particular state that this human being is in, their current mental state, emotional state, if we run a lab and it has some boogly woogly markers on it, could they handle that advice, or could they handle that data? And that's what we are there for, as their providers, to help, navigate that a little bit, mitigate some of the stressors. So I think sometimes there's a pro and con here, but I think the idea of the ignorance is bliss, it's not true, especially when it comes to things like diabetes, because the writing's on the wall, and especially when it comes to heart disease. High cholesterol doesn't hurt, right? There's the first sign of a heart attack is the heart attack. So that was the old saying, quite frankly. Now the writing is on the wall if we're looking behind the scenes. So, and we'll talk about, because those are some of the labs that I always encourage people to do. Let's take a look at your cardiovascular panel. Let's look at your diabetes panel. And I'll talk about some of the specifics tonight. And then the last, I think, is generally the cost that you might incur. If, like, how much do these things cost? And yes, they cost money. I work in a world right now that's doesn't include third-party pay. So people pay out of pocket. And that's for a couple of reasons, Karen. The insurance companies need a diagnosis. They need to say, this is wrong with you, this is wrong with you, therefore I can run this test. That's not the world we live in, or the world that I operate in. The idea is, how do I get you to optimal function? Yeah. We're going to run a bunch of tests or data points to help figure out the best strategy to become an optimal human being, or to lay out the next year or two for you, or wherever, or maybe cover up what you did the last decade or two. So cost is a little bit of an issue.
Yeah.
The beauty is nowadays, and I know it's a lot of money, but $1,000 will give you everything you need.
Yeah. Wow.
On the front end. It really will. So, and I know that's a lot. And I say that on the high end. Often you can run labs that might be a couple $100, $500 or something like that. And if that becomes your annual cost, the investment in your health, and that's how we have to start thinking, because listen, we just spent 2 years of the worst health crisis. I'm not even going to call it a virus issue anymore. It was a health crisis. And we have to start to, no matter where you are economically, you have to start thinking, I have to be able to invest at least $500,000 in my health every year to find out where I am, so I can create strategies. Most of the strategies you and I talk about, they're just personal habits. And so there's a lot we can do, even if it doesn't require additional money. So I think those are the three reasons that people kind of avoid testing. And again, that one, I think it is cost. They think that ignorance might be bliss, or they simply don't know what to test or who to test with it. So now let me just cover what I will consider. I think there's a lot of tests we run. I'll talk about the ones that I run on myself and run on my wife. The things that we do are sometimes above and beyond. But at this point in my life, that's when it is the most important thing I have, is my health. There's no doubt
for everybody. I mean, how much did the health you talk about cost? But I mean, how much does sickness cost us too, right?
Yeah. And regardless of the financial cost, what's the price of losing a day in your life? A day lying on a couch because your head hurts, or
a week, or dying 10 years early, 1 year early.
Yeah. All the above, right? So
you can't take any of that money with you in the end.
Right. And it's become so apparent that it's time for us to start to think about this vessel that we have as an investment. Yeah. So let me run through this. Just, I don't know where we are on time, but we're all right. We're getting tight. Let me run through this, because I think these are important.
Okay.
And whether
Yeah.
you
What are
run
the main
this,
ones?
yeah. So there's three primaries, and even in my panel that I have. So I have kind of a comprehensive male and a female panel.
Yeah.
They'll
And is this a
include
once a year panel then, that one you would run?
Correct. The ones
Okay.
I'm going to talk about now, in case costs are really an issue, are even less than my comprehensive panel.
Okay.
If you were to break them out, simply and go somewhere and say, Doc, hey, I want you to run these different things.
Okay.
I run a little bit more with these, but not too much. But these are the three things that I'd run. One, run a cardiovascular panel. And what does that include? Of course, it's going to include all your cholesterols.
Yeah. Okay.
We need to know your HDL. That's your good guys. We need to know your LDLs. Those are going to be around when there's inflammation in the body. And we need to know your triglycerides. That tells me if you're eating bad. But if you're sitting there with high triglycerides, and this is why it's so important to work with somebody and have the rest of the panel. If you have high triglycerides and you don't eat bad, you're not hanging out at McDonald's. So triglycerides are usually when you eat bad fats and that crap, right? And a lot of my listeners don't, but I see high triglycerides all the time. It could just be indicative of insulin resistance.
Okay.
Of thyroid dysfunction.
Yeah.
And that's why, Karen, we need a good picture. So if someone comes and they just go to their doctor once a year and they get their cholesterol panel done and there's high triglycerides or there's high cholesterol, period, but they don't know where they're from, they could be making a serious mistake by just going on a statin because they don't know why those cholesterols are high. So for example, in the cardiovascular panel, and this is the bummer, I don't see this often in the standard panels. There's two other markers that have to be there. Something called the C-reactive protein, which is an inflammatory marker, and something called the homocysteine. And we've talked about that for a fair amount on the show, but those have to be their bare minimum. My preference is that we also get particle sizes. Okay. And that will literally let us know that the sizes of all the different cholesterols. And really what that tells us is the cardiovascular risk. So if we have high cholesterol, lots of inflammation, and the sizes of the small guys, and they could fit through the little crevices, we got risk on our hand. Yeah. And it just tells us we got to make some changes fast. So that's one, the cardiovascular panel. And again, that would include all of your cholesterols, including things like C-reactive protein and homocysteine levels. The second would be your diabetes markers. So with this one, this is where we run things like hemoglobin A1C. This is where you do a fasting insulin, and we start to, again, see the writing on the wall. What's going on here? Are they higher than expected? Are they better than expected? Or one of the markers off? So we'd also run just regular blood glucose, just kind of see where we are. My favorite to run here, though, is something called, and a lot of the tests are called HOMA-IR, or really what's called the insulin resistance marker.
Okay.
If we have insulin resistance, heck, it can drive your hormones up or down. It can drive your cholesterols through the roof. And when it comes to weight loss, when people talk about running lab work for weight loss, this is the one that has to be run. Without knowing this, or your inflammatory markers, if you're trying to lose weight and you have high homocysteine levels because you have a methylation issue with MTHFR and you never figure that out, you can run around the world 4 times and you're not going to burn fat.
Yeah.
So there's things, and these are things we didn't know 10 years ago that we now have data points that we can kind of easily check. So if you're trying to lose weight, if you're trying to just figure out, why is my body not letting anything go? Yes, things are different, but you may have developed a little bit of insulin resistance. And what that means to us is in simple matters here, Karen, let's just say that I have insulin resistance and you do not.
Okay.
You eat a piece of bread, your body will then convert that bread real fast to sugar and put it in the bloodstream. Now you have some energy. And if you're using your energy, you'll burn up as much of that bread as your output is. Okay. So like if you're walking around the block, you'll use as much of that bread as it took you to walk around the block. The moment you sit back down, whatever bread is left over, your body will release insulin to grab that out of the bloodstream, the sugar out of the bloodstream, and store it in a fat cell. Okay. So for easy math, let's just say for every piece of bread, you release one molecule of insulin and you store it into one fat cell. Okay. Now for me, if I have insulin resistance, for every one piece of bread I eat, I will release 5 insulins and store it into 5 different fat cells. So I will get 5 times as fat for the exact same slice of bread if I have insulin resistance.
Yeah. Which everybody, I mean, people say that, hey, I can't eat, when I do eat this, it happens, but they're not testing things like their insulin resistance.
Yeah. And one of the biggest things there, Karen, is that this is what I'll hear most frequently. I used to just do this. I used to be able to eat this. And now because the way insulin, we develop insulin resistance over long periods of time of eating carbohydrates and sugar.
Yeah.
And throw a little stress in there. Eating late at night, having a glass of wine at night for the last decade, because we're putting sugar in the system. You're not walking around the block. So the body has nothing to do with it. So it just keeps storing it. And the more you make the pancreas overwork like that, you develop insulin resistance, because it's going, I hear you. Oh, you just want me to keep on producing insulin. And then after a while, it just kind of puts up the blinders. Your cells put up the blinders and say, no, I'm not going to listen to you anymore. That's how we develop insulin resistance. So that's another important one that if you're looking, especially if you have any weight loss goals, but even for nothing, just to know where you stand with that, because at least here in our country, I think it's like 50% of the people either are pre-diabetic or going to be within the next like 5 years, something silly like that. And again, it makes sense. When we really take a deep dive and look at our diets, maybe they're changed now. Mine has changed now, but I look at it for the first probably 40 years of my life. I grew up eating cereal, which is sugar and carbohydrates. So milk.
We all did, right?
Lactose,
I did too. Yeah.
Milk is a big source of sugar, right? It's lactose, it's OSC. So anything with glucose, sucrose, right? It's lactose. Converts to sugar immediately. Cereal, sugar. All brands, Wheaties, Raisin Bran, didn't matter. Fruit Loops, all sugar. So we start with sugar, and then typically during the day, you have maybe peanut butter and jelly sandwich. I don't care if it's a ham sandwich. You still had those 2 slices of bread again. And when you start to, let's say you didn't have the peanut butter and jelly, but you had the ham sandwich. Oh, the ham was good. When you put together a fat and like a fat protein, like a piece of ham, and you put a starch together, nothing gets worse. Then you go instantly to storage.
Really?
Yeah. Yes, exactly. You go to instant storage. And that's where the insulin resistance eventually starts to begin. And then at night, maybe it's pasta, maybe it's a big potato, right? So I look at my brain and heck, I probably 80% of what I ate, 80% of the time was
sugar,
carbs and sugar, right?
Yeah.
And I grew up what I think was probably just a pretty typical, diet for most people. So that's how we get there. All right. Last but not least, because I know we're getting short on time here, is get around the hormone panel.
Yeah.
Yeah. So this is where it gets.
How dysregulated are they mostly? If we talk about your stats, I mean, do you see those come back? You must see those come back quite often.
Say that again.
Well, quite often you must see the hormone panels come back with different imbalances and things. Like if we're talking about stats.
All the time. And again, it goes like this. Hormones don't choose to get out of whack. We teach them to get out of the whack. Our lifestyle drives them out of whack. Now, there's sometimes you may have a hysterectomy or something like that. And age plays a role, but it doesn't mean they're out of whack. But they go out of whack when our lifestyle forces them to go out of whack. So that happens quite frequently. And listen, guys, all of us, guys and girls, a robust amount of testosterone in your body is proven that will live longer, feel better, period. So if it's going low, wouldn't you want to know? So I just looked at a 30-year-olds today, and he was in the 400s. Yeah. So 400s is low, not for a 30-year-old. He should be 700, 800 minimum. But the rest of his labs look good. And this is the scary part, because I was the second doctor to look at these. And the first doctor, you look good. Everything looks good. Cholesterol is a little bit high. Come back in a year, we'll check it. Yeah. Whoa, that couldn't have been the worst advice. The writing was on the wall that this guy's on a fast decline. Most guys, in my experience after 25 years of doing this and being a guy myself, right around the age of 38 to 43, you'll hit your low point, because at that point you are overstressed, underfed, like everything has gone bad at that point. Overworked, overstressed. Nutrition has got worse. You don't train like you used to. All of those things add up. And then one day you wake up and you feel really, really bad. You're 15, 20 pounds heavier. You have no energy. You're cranky, all that stuff. And then you go to the doctor and they say, you know why? It's because your testosterone. No, the reason is because your lifestyle was crap and your testosterone went down, and you could have done something about it. So when we test testosterone, for example, and this is for men and women, we want to know total. We want free. We need to know the free. That's how much is being uptaken into the cell. And that tells us how well you can utilize If you have a lot of total but low free, we probably have a conversion. Something's clogged up in the liver. You have something that's conjugated, it's backed up in the liver. So we need to know those. You need another mark called DHEA.
Mm-hmm.
So that's made in the adrenal glands. It's a precursor for us to let us know how much testosterone is going to be made. It's also another marker for inflammation. So now if we go back to the cholesterol panel, sometimes someone has really high LDLs, but everything looks normal and you don't even know why they're there. But really it's because of stress, and you can see that in the DHEA. Okay. So we can start to see, oh, your cholesterol levels are high because of stress, because we have your hormone panel. We see the low testosterone, the low DHEA, the cholesterol is going up. There's writings on the wall. And if I was able to give that to a guy, so if a young guy, 30-year-old guy sitting in front of me, remember pleasure, pain. So real quickly, I'd say, listen, in a short period of time, sex is going to be out the window because things aren't going to work anymore. You're not going to have the right hormones to do it. You're going to be less productive, and most likely you'll decline at work, which means money to them. So that's the pain I tune up.
Yeah, that was good. That was a good.
Right? So
yeah.
Guys get that conversation right there. And they need to hear that one. Because just getting the cholesterol change doesn't matter to them. They don't feel that difference. And then the flip side, the pleasure may be, listen, you can literally change your body. Your levels are only 400. If you get them to 800, you feel like a Superman.
Yeah.
And all the other things that happen when you're a Superman. So free testosterone. This goes for women too. So we all need testosterone. They're just at different levels. We need DHEA tested. We also, men and women, need to test their estradiol, which is E2. It's a real important one. Women, you can't have that too high. We need it there if you want to make babies, but we don't want it too high as you go through that phase of postmenopause, et cetera. So we definitely want to check out what's that. And then we go into the hormone, the thyroid panel. Yeah. So for women, of course, we want to know progesterone levels. Those are super important. There's also another one, Karen, and this is why like the whole panel is important. I'm probably missing a couple here, but on my panel always has them. Something called a sex hormone binding globulin.
Okay.
Yeah, it just gives us insight. If it's high, it tells me that your body isn't binding your free testosterone. So you may have it, but you feel like heck, you're like, I'm out of energy, doc. And it might be a hormonal issue, but we don't see it because your testosterone's high. Most doctors will only run that total testosterone. They don't show us the free, and we don't get to see the sex hormone, globulin, binding globulin. And then the other one is, if that one is low, it indicates that you're going into hypothyroidism, even though your thyroid markers might be decent. Yeah. So again, there's so many other ways versus just looking at your thyroid panel and someone says, well, that's good. But you know that your eyebrows are thinning a little bit. You know that your skin might be changing a little bit. You're more sensitive to the temperature changes. Your fingers get a little colder than normal. These are all signs, subclinical signs, where they don't show up necessarily in changing the thyroid labs. And then, of course, if we're going to run thyroid, we absolutely need a total T4. We need free T3, again, the free hormone that's floating through the body. We need T3 uptake. Absolutely have to have the Hashimoto markers, which I shouldn't call them Hashimoto, but the antibody markers. We need vitamin D levels. And that's part of your hormone package, folks. Like, that's when we think vitamin D, think of that should be put into that hormone package. So if you're getting all that stuff and you provided your doctor, myself, with that data, and you had your cardiovascular panel, you had your diabetes panel, and you had your hormone panel, you could create an awesome strategy. Yeah. And even if you're doing good, you would be able to take those panels and figure out, how do I go from good to awesome, or to what we call superhuman?
Which is where then doing them every year, regardless of if you feel good or not, is helpful to just keep leveling up.
It really is. That's the way. That's your scorecard. That's, you check them, and you don't have, like, you don't put a lot of emotional energy into, oh my God, like they're bad or they're good. You're like, all right, what is, and then all you're looking for, what are the action steps I can take once I have these results?
And so I think doing them with a practitioner that you trust and has strategies that fit in with what you want is important too. Because if you do run them just with your doctor and you know that, hey, if cholesterol is going to come up, the only strategy they have is statins, then it gets, I think knowing, okay, if I get these results, who am I going to go to for help is important too, because then you know that you're going to get strategies that align with the way that you would want to address some of these things, if that makes
100%,
sense.
100%, Karen. That always reminds me of the saying that proximity is power.
Yeah.
Which really means who you are hanging around with and sharing your health philosophies with is critical, including your doctor. So if your doctor's basically like a sick doctor, understand you're going to get sick advice from them. As bad as that sounds, that doesn't make them a bad or good person. If your doctor is helping,
they only have a certain toolbox, right? And it happens to be antibiotics or statins or.
Listen, I am not knocking a single practitioner out there. I know all of those men and women are wonderful human beings. The challenge is when I see the strategies that some of the folks are taking on a daily basis, because that's what they recommended. If they had other options, they would never take those options. Because they're not the ones that really serve them well with where they're headed, where they really want to be in your life. If you say, listen, Karen, I'm going to give you 2 whatever rounds of antibiotics it takes to get this bacteria gone, might cost you everything. That's a conversation that doesn't happen. And you just say, no, what's the other options here? If I told you that a single round of antibiotics has a 50-50 shot of making you gain significant weight within 8 weeks, would you still take that antibiotic? Or would you then maybe say, maybe I'll just put down the sugar?
Is there another option? Might be the question.
Yeah.
100%. Yeah, no, I love it. Awesome. All right. Well, we've gone through so much info today. What's going to be the one action item that our listeners take to move them towards their goal of becoming superhuman?
And usually I think about them this one. So this one is going to say, just keep swinging the bat and just keep going for it.
Yeah.
Don't give up early. So no matter what age it is, no matter where you are with your health or how challenged you might be, listen, if you keep swinging, there's a likelihood you're going to hit it right. If you stop
in all areas of your life, actually,
always, right? Health, wealth, relationships, doesn't matter. But that is it. Because if you stop swinging, you ain't going to hit it.
Nah. So true. I love that. Good reminder for all of us. There's always one area of our life where I feel like we could always use a reminder to keep swinging, right?
Keep swinging. Amen.
Love it. Awesome. All right. Well, thanks so much, everyone, for tuning in. We'll be back same time, same place next week for another episode of the Health Made Simple show.
Yes. And of course, everyone, keep doing anything, keep sharing it out, keep spreading love. We literally don't know what kind of impact somebody hears one little thing, the kind of impact that can have in their life down the road. And of course, for yourself, keep doing your thing, keep taking deliberate action for your mind, your body, overall wellness. Y'all be awesome.